Hello everyone, this is Ashley Subman and welcome back to another episode of CNU Podcast. This program is a collaboration between the Corporate Communication and Alumni Relations Center and the Language Institute. And today news is CAMT and BAAK partner with Phramongkutklao Hospital to launch LINE-mediated home isolation system. So let's hear the news from Mr. Clayton Shuttleworth.
Thank you, Ashley. The rising number of COVID-19 cases has now exceeded hospital capacity, causing an increase in admission waiting time and difficulties in patient care. An alternative to traditional hospital care is home care. Unfortunately, it is difficult to administer as it does not allow normal procedures, such as data recording, follow-up, and data input, to be performed as effectively as the traditional form of care, in which practitioners can conveniently provide a close examination and record patient data. This has posed a challenge to traditional healthcare practices, and the incorporation of IT technology to overcome such difficulties is urgently needed. Assistant Professor Dr. Worawit Janchai, Dean of the College of Arts, Media and Technology, or CAMT, Chiang Mai University, revealed that he was contacted by a team of doctors at Phramongkutklao Hospital to consult on a project to develop a home isolation system. So, he gathered the staff working on medical informatics to come up with such a system as quickly as possible, as the number of cases had already exceeded the hospital capacity. Assistant Professor Dr. Orawit Thinnukool, head of the research group on embedded operating systems and mobile applications for health science at CMU, partnered with BAAK Company Limited, a CMU startup jointly owned by Angkaew Holding and Banana, a famous IT company specializing in creating back office for marathon events. The company provided services related to tailoring health platform solutions to patient care functions to organizations both within and outside the university. Before the implementation of the newly developed home isolation system, Phramongkutklao Hospital discovered that most patients who were elderly or had underlying conditions could not use social media, so there needed to be an easily accessible platform that did not require any additional steps. At first, the LINE application was used as the main platform, while data recording and checkups were done on Google Forms and Google Sheets. Despite regular system updates, it was found that the data stored in the Google platforms were slow to process, and there were instability issues due to the increasing number of patients. Moreover, the system structure could not accommodate the patient care practice outside the setting. These problems gave rise to this home isolation system, co-developed by the team at Phramongkutklao Hospital, led by Lieutenant Colonel Wasikasin, medical doctor, Major Nashaporn Nopakra, medical doctor, Jantima Trai Patanagun, medical doctor, and the team from CMU. The framework of this project, Center for COVID Patient Care Coordination by Phramongkutklao Hospital, is home isolation. However, instead of admitting patients with mild symptoms following the general principles of home isolation, this system oversees patients with mild to moderate symptoms with a high chance of aggravation in order to minimize the chance of developing severe symptoms. The hospital will take care of all patients under its responsibility, even those who test positive at other healthcare institutions. The only criteria is that the patients do not have hypoxia and/or hemodialysis history. Once admitted, the patients will get a chest x-ray on the first day and be prescribed favipiravir if pneumonia is found or there is risk of it developing, and they will be treated with corticosteroids when hypoxia starts. Moreover, the patients will have 3 meals delivered to their place every day, and their conditions will be monitored at least twice daily via the LINE application, using the data obtained by the provided thermometer kit and fingertip pulse oximeter. It took only 2 weeks to develop the system and link it to the existing medical record system, and now the system has already been implemented at the Center for COVID-19 Patient Care Coordination. It is easy to use and allows the patients to access preliminary care and get an effective assessment of their conditions. It also helps enhance coordination between doctors and nurses so that any changing conditions can be readily observed. Furthermore, the fact that it is linked to the hospital's record system leads to more accurate operation, as well as reduced paperwork and workforce required to fulfill the coordinating responsibility, thus allowing more practitioners to be allocated to patient care. At present, the team from CMU has also developed a bed booking system for efficient bed management that helps support the government's home isolation policy and the preparation for future waves of infection.
Thank you very much, and that's it for today. Please stay tuned to the next episode of CMU Podcast on YouTube and Facebook, and don't forget to follow the hashtag CMU Podcast. Until next time, thank you and goodbye.